Hi, this is Eddie Garcia, Senior Vice President at Healthsperien, and this is For the Health of It. For the Health of It is a weekly podcast covering all things health policy, brought to you by Healthsperien, a nationally recognized health policy consulting firm focused on federal and state regulatory and legislative analysis, advocacy, and implementation issues. On today's episode, the Healthsperien team, along with other guests, will continue to dive into the evolving COVID-19 national emergency and public health crisis. This week, we'll explore the deluge of legislative and regulatory activities, including the recent CMS Telehealth expansions, and the effects of necessary social distancing on social isolation and loneliness. We offer insight and analysis into the current state of play and the larger implications that affect stakeholders across the spectrum. Up first, our weekly Healthsperien.
Hello, I'm Tom Kasupis, founder and president of Healthsperien, and this is your weekly Healthsperien. Obviously, as we all know, the coronavirus crisis is upon us. It's creating tremendous anxiety, tremendous uncertainty, and frankly, we're all frightened about where it will go and how it will end. With that said, what I'm seeing is an extraordinary move forward by all of our healthcare professionals across the nation. Healthcare professionals determined to all pitch in, all work together in a very collaborative and coordinated way to address this issue, whether it be in hospitals, in ERs, or at home. I think the main challenge that we have at this moment is making sure that we all have the right equipment, particularly the protective equipment and the test, to allow us to treat patients and families once we suspect that they may be subject to or have the coronavirus itself. What I do know is with the right equipment, all of our healthcare professionals are ready, willing, and able. They're motivated, they're motivating, and they're coming together to take this on in a very, very dynamic way. At the end of the day, we will win the battle.
Now join Healthsperien policy experts and friends for Stay in the Know, a weekly segment of the top health policy activities of the past week.
And welcome to episode 2 for The Health of It. I'm Wes Adams, a health policy analyst at Healthsperien. Thank you to all who are tuning in. We have an awesome lineup of speakers and SMEs here to provide comment on some key policy updates from this week occurring in the healthcare sector as it relates to the COVID-19 crisis. As always, if you have any questions for us or would like to provide comment, please do not hesitate to reach out through our website at healthsperien.com. Well, on that note, to start things off, let's begin with a huge sigh of relief. Finally, by the grace of the health policy and telehealth gods, CMS released guidance on Monday expanding telehealth coverage in Medicare through 1135 authorities, as well as guidance and recommendations for the coverage of telehealth and Medicaid to help improve access to general care and services for populations most vulnerable. HHS was finally able to utilize this authority after the president declared a national state of emergency on Friday, March 13th. In sum, the CMS waiver allows a slew of new flexibilities, which essentially allows more Medicare beneficiaries to receive telehealth in the comfort of their home, while waiving or providing flexibilities to certain requirements on the provider end related to telehealth services and the platforms used to provide them. Luckily, to provide a more in-depth analysis of what this waiver does, we welcome Tom Bednar, Vice President here at Healthsperien, to walk us through what 1135 waiver authority is and why it applies here, and maybe two, what does the CMS waiver do specifically on a more granular level? So on that note, Tom, what's going on? The mic is yours.
Great. Thanks, Wes, and thanks for having me on and talking about this very important issue in this ever-changing world of ours. So to address the first part of your question about what the background is here, what Section 1135 authority is. So Section 1135 is authority under the Social Security Act that allows the Secretary of HHS to waive large elements of Medicare, Medicaid, and CHIP in cases of national emergency. It generally requires the declaration of emergency by the Secretary of HHS, which Alex Azar did on January 31st, as well as the President of the United States under certain other federal authorities, which the President recently did as well on, I believe, 13th. So with the opening of the door for Section 1135 authority, what we've seen is a wide slew of regulatory guidance from CMS and HHS. One of the major topics has been what we're talking about today, telehealth. an expansion of telehealth services, both in the Medicare and the Medicaid side of things. And what the announcement that was released by CMS, which came out on the 17th, was also related not just to Section 1135 authority, but also was tied to the first congressional package passed by Congress on March 4th.
Mm-hmm.
Now, that March 4th package had language in there that expanded Section 1135 authority to cover the removal of regulatory barriers for telehealth benefits. So basically, Congress said, hey, HHS, once you are allowed to trigger Section 1135 authority, you can also expand access to telehealth benefits.
Right.
And the moment that the president declared a national emergency, the secretary was then free to use this brand new authority under Section 1135 to issue the guidance that we saw on March 17th.
Interesting. And I understand that, the CMS waiver specifically, everyone's highlighting how it waives the originating site requirement as well as the established relationship requirement. Would you be able to provide any comment on those two specific things, as well as maybe some of the additional services? I know people have highlighted the mental health services that can be provided through telehealth now too. They basically shine light on what those specific flexibilities are. Yeah,
absolutely. So you highlighted two of the key main changes. So as a bit of background, the way the telehealth under Medicare is reimbursed is that it can only be reimbursed if it's being provided from at an origination site, which is where the patient is, and only certain places could count as origination sites. And the service would be provided by a provider at what's called a destination site. So the person on the other end of the whether it's a phone or a video chat would be at this destination site, and that would be the specialist or the other kind of provider that's providing these services. Now, under current Medicare regulations, the origination sites could only be certain kind of clinics and certain kind of healthcare locations. Couldn't be in the patient's home. And this was in part as a means of avoiding fraud, waste, and abuse. However, under this as a result of the pandemic and our overarching need to maximize social distancing and limit exposure, the Secretary deemed it fit to waive that origination site requirement, meaning many of these services can be provided inside a patient's home, which of course broadly expands the utility of such services.
Yep.
And the second thing, the established relationship requirement, again, prior to this waiver, there was a requirement that the patient have an existing prior relationship to the provider that is providing these kinds of telehealth services. Again, this was a means in part to protect against fraud, waste, and abuse. However, for the same reasons that I listed before about the need to maximize social distancing and to allow for the ease of better screening, better access to initial primary care visits and consultations, and for a number of other reasons, the Secretary waived that requirement. Mm-hmm. Those are two huge changes, and hopefully you'll see a significant uptake in an adoption of telehealth services throughout the country reimbursed under Medicare.
And I think, picking up on that last point, with the increased uptake of telehealth for not just COVID-related services, but, just general services, as you mentioned. And what do you think the state of play is going to be for telehealth after this public health emergency ends? Is there going to be a new focus or shift in the healthcare system, you think, favoring telehealth, or do you think things will kind of go back to how they were before?
That's a great question, and I would actually direct listeners to market analyst reviews of organizations like Teladoc, which is a publicly traded company. And their analysis suggests that these companies expect a shift in the adoption curve of this technology. So what that means is that, exactly as you suggested, it is very possible that the expanded access to telehealth services could, in the long term, redefine the landscape in this kind of still burgeoning market and delivery system as folks are suddenly exposed to it and access is suddenly opened up to it. It is definitely possible that we see some long-term changes in the underlying regulatory structures related to telehealth as a result of what is essentially an experiment in the deregulation of the industry. There's a lot of speculation right now around that, but I don't think it would surprise anyone if that would be the case in even a few years.
Yeah, no, absolutely. I totally agree. And I think also, given that the Office of Civil Rights has provided some flexibility in terms of the platforms that can be used to provide telehealth. I mean, even in that aspect, do you think that the current telehealth sector has the capabilities and capacities to meet the demands of this waiver?
It's a good question. One of the main hindrances of telehealth uptake has always been the underlying infrastructure and means by which folks can actually communicate with providers. There are very strict regulations about the nature of this kind of communication, whether it's synchronous or asynchronous communication, meaning whether it's a direct back and forth similar to the type that we're having right now, or whether it's asynchronous, meaning I send a message via, imagine like a direct message to my provider who then reviews it, and that could include images and then sends a message back. That would be asynchronous. So there's a lot of nuance to this. And I do think that it will be informed by essentially this experiment of allowing such technologies as FaceTime, Skype, otherwise commercially and generally widely used forms of communication within this realm. I do think that there needs to be, in the long run, a continued concern around the potential misuse of such technologies. I think that those safeguards exist for good reason. And we can't simply just keep the door open to any and all providers, because there's a great opportunity for misuse in the space. And ultimately what happens then is that you have a significantly increased cost to what is overall a federally paid program.
Right.
But I do think this will be a great opportunity to make some advances.
Yep. No, I completely agree. And to touch on that point, I think the fraud and abuse concerns are very legitimate. And this waiver and expansion of telehealth really applies to a specific set of doctors and practitioners and providers, especially in the primary care space, where it could benefit service access. But I think, as you said, it's also key that we at least observe or are cognizant of the areas of abuse that could stem from the expansion of the telehealth.
Yep. And one thing I'll point out, we've been talking almost exclusively about the waivers in Medicare. Simultaneous to this, CMS and HHS issued expanded access to Medicaid telehealth services. Telehealth in Medicaid is governed differently. It's far less regulated. It relies on some of the same kinds of Medicare telehealth regulations, but not all of them. And it's far more dependent upon the existence of state statutes on telehealth services and how individual Medicaid programs choose to reimburse for those entities. So the guidance that was released focused primarily on state fee-for-service Medicaid programs. But again, there's going to be the interaction between this guidance and state telehealth statutes is going to be more pronounced in the Medicaid space and then perhaps in the Medicare space. Not to say that state statutes are irrelevant in Medicare. They certainly aren't. But by virtue of the fact that the state statutes on the Medicaid side of things serve a more primary role, it'll be interesting to see to what extent states choose to adopt these flexibilities in their subsequent request to the federal government, who's the Section 1135 authority for their Medicaid programs.
Right. And I also understand that, aside from 1135, state Medicaid agencies have obviously the option through state plan amendments as well as 1115s to expand telehealth services. And is there any way that you might be able to shine light on the difference between those three different authorities and how they may interact with each other here moving forward, maybe specifically to telehealth right now?
Yeah, so the primary method is, so unlike Medicare, which is federally facilitated and therefore can be changed nationally through Section 1135 authority and through other means, Medicaid is, of course, a state-run program, primarily a state-run program. And a state's Medicaid program is generally captured in its state's plan, in the state plan. So any sort of changes to that plan have to be submitted to CMS for review and approval, and you do so through a state plan amendment. That is general mechanism that states use, not just in emergencies, but anytime they change any sort of element of their state program. Separate and apart from this, you have Section 1115 demonstration authority, which is a wide range of requests for states to request waiver of certain federal Medicaid requirements to test certain things in Medicaid. Again, that is an avenue that is generally available for states outside of emergencies, is widely used authority for a number of different types of interventions. But then the 1135 authority is unique in that it's specific to the emergency preparedness or emergency response efforts of states. And so what you're likely going to see is primarily in the telehealth space a focus on or using the 1135 authority for these kinds of telehealth purposes in combination with changes to their state plans via state plan amendment. The one thing that will remain interesting to watch is the duration and scope of the changes that are being requested. The first request under 1135 authority we've seen thus far has been from Florida. Notably, they didn't explicitly include 11 changes to their telehealth benefits because they actually submitted that prior to the flexibility or the announcement related to telehealth. So that may come afterwards. And subsequent states may now include telehealth requests in their 1135 requests.
Interesting. Well, I do think that, there still is obviously a lot to happen in the telehealth space. Telehealth is a really hot topic right now, but, even beyond that, in your opinion, what are some of the key areas in Medicare and Medicaid that still need to be addressed, despite this expansion?
It's a great question. So a few remaining topics that come to mind. First, on the long-term outlook of rate setting, I think this is something that Congress could think about. And at least I'd be interested in seeing Congress think through the long-term impacts of the changes to both Medicare and Medicaid rate setting as a result of the uptake in utilization, and on the Medicaid side, the addition of newly covered individuals under the recently passed package, although that only applies to COVID testing it doesn't even apply to treatment. And moreover, the transition, as we see more folks transitioning away from the individual exchanges as folks lose their jobs down to Medicaid or onto Medicaid, I think there's going to need to be a long-term consideration of appropriate rate setting so that we can ensure these programs are stable and always there for the beneficiaries that need them.
Right.
I think that I had one other point that I just completely escaped me.
Well, I do think that's a general, to piggyback on that last concern, I think the Medicaid migration issue and how the long-term impact of that will be on state Medicaid systems and the viability of such systems is a legitimate concern that maybe has some evidence that helps support it as well historically. I also think on the provider side, even with the telehealth guidance specifically, there's already issues starting to make its way through the woodwork in terms of how other providers, such as, let's say, home care providers and medicine docs, should bill for evaluation management services because they have their own CPT codes that weren't necessarily referenced in the guidance. And there's just very technical nuances that will have to be addressed on that side as well. But
I think that's right. I remembered the one point I had that was specific to Medicaid and specifically in that long-term services and supports angle. This pandemic and outbreak is going to place significant stress on at-home care attendants. And oftentimes in the long-term services and supports market, many of these attendants are family members that are unpaid caregivers. And there's specific regulations governing when you can and cannot pay and who does and does not qualify for reimbursement under Medicaid for home and community-based services or managed long-term services and supports. I think that angle needs to be addressed, especially as we continue to isolate individuals that already have long-term chronic needs. And I think that avenues need to be explored about potentially loosening some of those reimbursement restrictions as a means of mitigating the economic impact on an already vulnerable population and their caregivers.
Right. That's a great point. I didn't even think about that point up until this talk. So thank you for raising it. Well, you know what? Thank you so much, Tom. We look forward to seeing how this all plays out. We'll continue to provide listeners updates on additional supplementary guidance CMS releases specific to the telehealth expansion during this crisis. But moving on, Tom, for our listeners here, do you have any closing remarks or maybe like a overzealous, ill-timed motivational quote to close out this segment?
You're teeing me up there. I'll avoid quoting famous movies, but I'll just say that this is an unprecedented time in our nation's history. And I think that I'm confident that we will get through it. And I think now is the time to start thinking about how we can restructure our healthcare and safety net programs for the better and learn from the lessons that this epidemic and outbreak have provided us. So I would urge folks to be vigilant, to be mindful, to first and foremost take care of themselves and their loved ones, be safe in this current time, but also in the back of their minds to be thoughtful and reflective about the changes that we can implement down the road. I know that we at Healthsperien will certainly be doing that as well.
Awesome. What a guy. Well, thank you so much, Tom. We look forward to speaking to you again.
Great. Thanks so much, everybody. Bye-bye.
Bye. To continue our discussion today, I want to touch on a very important public health topic, specifically as we, the country, continue to respond to the ever-evolving public health challenges of the COVID-19 outbreak, and specifically social distancing interventions. We at Healthsperien want to reinforce the need for listeners and friends is to be cognizant of the mental health issues that are associated with long-standing social isolation. For those already experiencing issues, like many of us here in DC, it's important that we take time and the necessary precautions to remain socially connected. On that note, the Coalition to End Social Isolation and Loneliness, which is a coalition here in DC, has a great hashtag floating around on Twitter right now saying to be, quote unquote, isolated, not lonely. And we believe that really hones in on what we need to work on here as a community while we look to also socially distance ourselves and protect ourselves to, quote unquote, flatten the curve. So excitingly here, we actually have the manager of the coalition, Nora McKenzie, here to kind of help comment on what the coalition has done in this space, as well as what resources listeners can access to view the effects of social isolation on health outcomes, as well as what interventions they can do right now or uptake right now to stay socially connected. So on that note, hi, Nora.
Hi, Wes. Thanks so much for having me.
Yeah, no problem. Do you just want to give a quick introduction to yourself and the coalition?
Yeah, absolutely. So as Wes mentioned, my name is Nora McKenzie. I'm the manager of the Coalition to End Social Isolation and Loneliness. The coalition was founded in late 2018, and we're a really diverse set of national organizations, including consumer groups, health plans, healthcare providers, technology innovators, patient advocates, health plans, and more. And we really do come together to focus on the federal policy solutions to reduce social isolation and loneliness among all Americans. Mm-hmm. So as everyone knows, right now in the COVID-19 pandemic, everyone is encouraged and some are required to socially distance themselves as a result to prevent spreading the disease to others and prevent getting the disease themselves. So right now, it's very important to raise awareness of the issues of social isolation and loneliness and what we can do.
Absolutely. And I think even looking at the website now, if listeners want to view the website as well, you can find the coalition's site at endsocialisolation.org. It looks like you've posted a slew of new resources that viewers can look into. Would you mind describing those?
Definitely. So we've been monitoring the situation very closely. And on our website, we've put together a resources page with a slew of information about the issue of social isolation during this pandemic. So you can find that page at www.endsocialisolation.org/COVID-19, and there are a ton of resources there. We're also extremely active on Twitter and are pushing out as much information as we can to raise awareness of this issue. And you can find us there at endsocialisolation.
Yeah, I think for those of you that are on Twitter, definitely check out the page. The Coalition to End Social Isolation has an awesome infographic, which is floated around in the Twitter sphere, which highlights some of the key actions individuals should take to prevent loneliness while being isolated. Just reading it off the bat now, and Nora, I know you can probably speak a little bit more to this. The coalition highlights the importance of remaining socially connected in this context. Connect with family and friends when you can. Try to use this time as an opportunity to check in with others over FaceTime or Skype. The infographic also shows, it's important to help your neighbors when possible and when safe. Running an errand for a neighbor, as we've seen in news across the nation, especially older neighbors, not only helps them, but will also make you feel more connected to your community. And then the coalition also advises to maintain a well-balanced lifestyle, as well as staying positive in general and focusing on the altruistic reasons for social distancing and how that can help mitigate anxiety or stress of the situation. So anyways, the coalition has been very active in this space. And for listeners who are interested, Nora, what are some things that they can look forward to that the coalition may release in the future? Or what are other actions that the coalition may look to take to help address social isolation, or better yet, to improve social connection in this time of social isolation?
Yeah, absolutely. So right now, what we're doing as a coalition is working on compiling a list of federal policy recommendations to take into consideration during this pandemic to really focus on making sure people affected by this crisis are socially connected as they practice social distancing. As you mentioned, Wes, we do have our infographic out that can be found on our website and Twitter, but we also are going to expand that into a more detailed one-pager that will really describe this issue. So that'll be on our website soon, so look out for that as well.
Awesome. Well, thank you so much, Nora. Once again, I urge all listeners to check it out. The website is endsocialisolation.org. If you have any questions or would simply like to reach out to the coalition to express support or comment, please feel free to reach out. Is there an ability to do that on the website?
Yes, you can, or you can email us at info@endsocialisolation.org.
Awesome. All right, guys. Well, once again, thank you again, Nora. And for those listeners, remember, isolated, not lonely. That's very important.
Yes. Thanks, Wes.
I'm going to turn over to Andrew McPherson, Managing Partner at Healthsperien, to shed more light on the recent events and a general recap of what happened on the Hill this week and to provide a personal assessment of what to expect moving forward. So on that note, Andrew, would you be able to provide us just a general state of play of what's going on here?
Sure. Yeah. Thanks so much, Wes. So again, as you said, name of the game is there is a major shared goal here, which is to pass a massive spending package essentially as soon as possible. Americans need relief as soon as we possibly can. Last night, the Republicans Majority Leader McConnell introduced a pretty significant stimulus package to the tune of $1 trillion. Some of the major components include direct payments to qualified Americans of up to $1,200 or $2,400 for a couple, with some limits with respect to individuals' income. So folks who earn more than $75,000 annually will see the payment reduced by $5 for every $100 they earn over the $75,000 threshold. It also has a significant amount of funds for small businesses to the tune of $300 billion for federally guaranteed loans. So really extraordinary piece of legislation. With respect to healthcare, though, a couple of major components that I think are worth noting. One is in 2011, there was a piece of legislation that required an across-the-board, what's known as a sequester or a across-the-board payment cut to providers in the Medicare program. The legislation introduced last night that would be Thursday, March 19th, by the Republicans actually temporarily freezes that sequester or the Medicare payment cut across all providers. So it would be an immediate 2% payment increase for providers. And it also includes a 15% Medicare rate bump for coronavirus patients that would go to the provider community. It also includes, for health insurers, they would now need to cover coronavirus vaccines, and they also would allow for greater access to telehealth, for example. The proposal includes temporarily allowing Medicare patients to virtually consult with doctors, even if they don't have a pre-existing relationship with that provider. So I think there's a lot to like in the package. The major question, Wes, is do the two other significant issues of the day, surprise billing and comprehensive drug pricing reform, for example, H.R. 3, the Democrats' version of the legislation in the House on drug pricing, or Chairman Grassley's legislation, drug pricing legislation, will either of those approaches be included in a final package? And I think that the chances for surprise billing, I would say, are increasing. The chances for drug pricing are decreasing. The pharmaceutical life science community has been largely opposed to the Chairman Grassley and Ranking Member Wyden legislation that passed out of committee back in July. I would guess that the leader McConnell would be concerned about losing some of those rank and file Republican senators if that drug pricing legislation were to be added to the $1 trillion stimulus package. And he would not want to vote that was close on the stimulus package, as you can imagine.
Right.
I think he'd be shooting for more like over 90 of the 100 senators to clear the package rather than a close vote. So we're keeping an eye on this as the situation unfolds, and we'll be sure to share further updates.
Right. And thank you, Andrew. And to kind of build on that note, I think another topic too is there are a number of extenders that are meant to be passed by a deadline of May 22nd, one of them including an extension of the Independence at Home demonstration, which could improve access to home care medicine, which right now it seems like would be an obvious improvement for the current situation. And do you have any update on what is the status of those extenders with this stimulus bill?
Sure. Up until the pandemic became, truly just a national crisis and a national emergency was declared, and we've all just focused squarely on dealing with the pandemic. The major legislative deadline that all of Washington really was focused on was May 22nd, 2020. So this upcoming May 22nd, that is the date that the so-called extenders, or the extension of important programs whose funding was expiring at the end of last year, that was the date that those quote unquote extenders, those programs, the funding was extended to. Well, that date has become less relevant, Wes. The House, for example, has actually left Washington for the foreseeable future. They're trying to come up with creative ways for members of the House to vote, given the coronavirus situation and the importance of social distancing. These extenders will likely be included either in this next package, this $1 trillion package, or another follow-on package to address the pandemic, which would be the fourth in a series of major legislative proposals and actions that have been dealt with by the Congress and this administration. So sort of up in the air at the moment, but I know that there's just a furious amount of activity and advocacy to ensure that things like the Independence to Home demonstration and other extenders are included in one of the upcoming legislative proposals.
Great. So looking ahead for next week, should we expect this third stimulus package to be approved first thing, or are there any obstacles in the way that you see coming up?
Sure. I mean, the Democrats will now have their opportunity to respond. I know today is Friday, March 20th. I know that the Senate Democrats are conferring today with the Republican authors of the legislative proposal, the relief proposal, and the Democrats there'll certainly be the negotiation there, and sort of hard to tell how this is all going to end up. I have no doubt that they will pass another major package, but the Democrats now have their opportunity to weigh in. But we just heard from Majority Leader McConnell yesterday on the floor of the Senate saying, quote, "We need to take further steps to continue addressing our nation's healthcare needs." They're hearing from all sectors of the healthcare industry, and so I have no doubt that something will pass quickly. What that looks like remains to be seen.
Interesting. Well, thank you so much, Andrew, for giving us a state of play here and a summary of what's going on. Obviously, there's been numerous things that have happened starting at the beginning of this week through the administration with CMS flexibilities on telehealth, with the first coronavirus package. Obviously, this new stimulus that was introduced on the 19th is massive and definitely a new level of attention that we haven't seen yet. But we look forward to keeping in touch with you and keeping us updated on the situation. Do you have any closing remarks or anything you'd like to say to listeners as they continue to try and track what's going on here on the Hill?
Just to say that this is a just extraordinary moment in healthcare and health policy and for our nation. And if we play our cards right, if the Congress works on a bipartisan, bicameral basis and continues to work closely with the Trump administration, I do believe that we as a community and as a country will be able to push back on this pandemic and really provide relief to Americans.
Awesome. Well, thank you so much, Andrew, for your time. We look forward to speaking to you again.
Thanks, Wes.
And here's our industry trend foresight.
Hello, this is Jean Dessau, Senior Partner at Healthsperien and President of Healthsperien X. One of the differentiating factors in this pandemic has been the availability of advancements in telemedicine to address the needs in the pandemic. And many observers, as events unfold, have underscored its potential to support social avoidance strategies and maintain care for patients. Healthsperien is closely following the use of telemedicine as these events unfold. But concerns about the sector are that it's not pandemic ready, and that despite the views of its potential, the infrastructure is not fully there at scale to address the massive needs that we expect in the population. It's important to note that this industry has been steadily evolving with some slow consumer adoption as consumers and clinicians have been feeling their way, and as companies and providers have been navigating complex regulatory and reimbursement challenges. As a result, we find ourselves with a technology in transition, and questions are arising about how quickly we can get to the scale we need to address the pandemic and the healthcare needs of the population. One of the main challenges that has been emerging is having enough clinicians to support the demand for telemedicine in affected areas in particular. Recruitment efforts are underway, but again, this is a new massive development for needs for technology that was evolving under more steady times. Consumers also are facing challenges, patients are facing challenges engaging with and using new technology. Again, this is the technology that was slowly expanding. There was a slow adoption curve for the use of telemedicine services, and now the need for it is in stark relief. There's a lot of activity providing regulatory relief, for example, allowing greater across state lines practice, And also changes in reimbursement are going to be evolving to handle the greater adoption of this technology. On the other side of this epidemic, we expect a sea change in the sector with much greater and more rational use of telemedicine services and a regulatory and reimbursement structure that will support it. Healthsperien will be exploring this trend in future podcasts, and thank you.
For our last segment, here's the outlook of the week ahead.
Hello, my name is Melissa McHale. I'm a health policy analyst at Healthsperien, and I'm going to just talk about some 2 to 3 key issues that we're going to be seeing in the week ahead. Let's start with Congress. Last week, they passed phase 2 of the economic package, which is meant to stimulate and offer economic relief to people who are laid off or struggling financially because of coronavirus. And now Congress is working on quote unquote phase 3 of this economic package. It's speculated to be $1 trillion economic stimulus, which is just meant to help certain industries writ large that are struggling with coronavirus, like hospitality, flights, airplanes, things like that. So we're seeing some measures being released, or Congress is going to be working on these measures within this upcoming week. Senator Mitch McConnell, Majority Leader, said that the Senate is not going to leave until they get a bill done. While Senate Republicans are working with the Treasury to provide this $1 trillion stimulus, House Democrats are also kind of working on their own third stimulus package, which I think, again, aims to offer more economic relief to everyday Americans and may not be as industry specific. So they'll be focusing on, again, enhanced unemployment insurance, offering, again, just extra economic assistance for anybody who may be struggling or laid off during this pandemic. Another thing that's going on is that there is currently a shortage of personal protective equipment. And currently the states are working with the federal government to try to get more of those things because there's currently a shortage of the masks that are necessary. So the task force is trying to work at the state level to provide more of those resources. Manufacturers are trying to ramp up production of that as much as we can. So you may hear more of those issues in the coming week. In terms of providing treatment or finding a vaccine or some sort of solution for COVID-19, the FDA is currently in the process now of trying to find something. They just are looking at pre-existing findings that they had done during the SARS outbreak in the early 2000s, and they're finding that certain things that have been effective for malaria, they're going to test out to see if that can be an effective means of treatment or relief for people dealing with coronavirus. So we talked about Congress, we talked about some of the things going on at the state level, some of the things going on with the federal agencies. A last thing that is also really important is that because on March 13th, the president declared officially a national emergency. And now that the president has done that under the Stafford Act, Section 1135 of the Stafford Act allows a lot more flexibility for the federal government to offer funding or assistance to state and local municipalities. A big thing to be on the watch for, not only this coming week, but coming weeks in general, is states releasing their waivers for this extra emergency assistance. So state Medicaid agencies will be submitting Section 1135 waivers, which is meant to get that additional emergency funding, which will go towards the state Medicaid programs to offer testing to people who are uninsured, to offer testing to Medicaid beneficiaries without cost sharing, and also to just offer extra containment and treatment wherever they can. So states are really using their Medicaid programs as a vehicle to help treat and contain the virus. And so we will likely be seeing more activity from states submitting waivers to get that extra help from the federal government. And those are some of the top things that we're going to be looking at in the weeks ahead.
Well, that's a wrap for this week. Thanks for tuning in. If you have any questions on anything you heard on this week's episode, please head over to healthsperien.com for more information and deeper analysis. And as always, tune in next week for more policy insights.